Hello everyone, myself Sriram K, Associate Professor in Department of Pharmacology. Today we are going to see the topic of pulmonary circulation, which is the part of the cardiovascular system. So get into the topic. So what is pulmonary circulation? See, the portion of the circulatory system that carries deoxygenated blood from the heart to lungs and returns oxygenated blood back to the heart. So generally what it tells is, so heart will supply the blood to the whole part of the body. But in the pulmonary circulation, where the exchanges happen, blood exchange happens only to the heart and the lungs. So this is mainly because, so once we inhale the oxygen has to be transported to the blood. So this blood is transported via the pulmonary circulation. So once the deoxygenated blood from the heart, it goes to the lungs. From the lungs, the oxygen is transferred to the blood. So the oxygenated blood coming back to the heart. So this is the total pulmonary circulation overview. Okay. It is also called as lesser circulation because the circulation happens only between the heart and the lungs. Okay. So going to the topic, this is the pathway overview. So as we have seen that this happens only between the heart and the lung. So how the flow will be, so from the right ventricle it goes into the pulmonary trunk. So the pulmonary trunk will carry and it will transfer to the pulmonary arteries. So the pulmonary arteries, it get into the lungs where the gas exchanges happens. So from the gas exchange, the oxygen is transferred to the blood. So from the blood it goes into the pulmonary veins. So the oxygenated blood going into the pulmonary vein. From the pulmonary vein it coming back to the heart via left atrium. Okay, so this is the entire circulation happens between the heart and the lungs. Okay, so just you can see in the picture. So this is the exact flow of the blood. So next, key vessels. So what are the key vessels associated with the pulmonary trunk? So generally it arises from the right ventricle. Okay, so the right ventricle having the deoxygenated blood. So the pulmonary trunk will get the deoxygenated blood and it will make them to pass through the lungs. Then it divides into the right and left pulmonary arteries. Okay, so the pulmonary trunk divides into right and left pulmonary arteries. So coming to the pulmonary arteries, which carries the deoxygenated blood. Only arteries in the body that carries deoxygenated blood. This is the exact key point you have to remember, because all the arteries will carry the oxygenated blood, but only this pulmonary arteries going into the lungs which carries the deoxygenated blood. Then it goes into the branches. The branches repeatedly separated into arterioles and pulmonary capillaries. So once it reaches to the lungs, then the oxygenated blood, okay, then it will be having the exchanges happens. So once the oxygen is transferred to the blood, then the pulmonary veins where the carry oxygenated blood back to the left atrium. Okay, totally four veins are have within the process. So these veins will carry the oxygenated blood back to the left atrium. So only veins in the body carries oxygenated blood. So as like the arteries, so this is the pulmonary vein. Only vein, all the veins in the body will carry deoxygenated blood, but only pulmonary vein will carry the oxygenated blood. Then pulmonary capillaries. So pulmonary capillaries, this is the site of a gas exchange. So this is where the oxygen and carbon dioxide are exchanged. So this is dense network surrounding alveoli, air sacs. So alveoli, it is located in the lungs. So where it is like air sacs where the exchanges of the oxygen and carbon dioxide happens. So this is extremely thin walls, just one cell thick for rapid diffusion. The surface area is 70 millimeter square, 70 m square. The size of tennis court. Okay, so the surface area, as you can see, there is it is a larger size. We cannot imagine the size. It is like the size of a tennis court. That much big we have the surface area. That is why it is 70 meters square surface area. Then blood gas barrier thickness only 0.5 microns. So this is the key points you have to remember. Then going into the gas exchanges process. So what happens in the pulmonary capillary is oxygen is loaded from the where the oxygen is loading. Deoxygenated blood arrives, okay, at the 40 mmHg. Then alveolar pressure is 100 mmHg. Then oxygen diffused into the blood. So this is where the pressure is getting into the concept. So once the pressure is differentiation, so the pressure difference within the lungs will make the oxygen diffuse into the blood and carbon dioxide diffuse out of the blood. So this is where the diffusion of carbon dioxide, oxygen loading and carbon dioxide unloading happening. Okay, so these are the pressures that are happening within the cell. Okay, these are the pressure. Just you have to remember these pressures. So this result, at the end result, we have blood leaving the lungs at the pressure of 100 mmHg and the carbon dioxide 40 mmHg. Okay, so this is the final result. Then what is the hemodynamics? The low pressure system. So this is like just like we have system circulation. We just know that the pressure of the, so generally what the blood pressure will be calculated is only systemic circulation blood pressure is calculated for our clinical purpose. But there is a pressure in the pulmonary system also. So that pressure is mentioned here. That is 50 to 25 mmHg. The diastolic pressure is 8 to 12 mmHg. So the mean pressure and resistance, okay, as you can see in the table. So unique, what is the unique feature? The unique feature is entire cardiac output passes through the lungs. That is 5 liter per minute. So generally 5 liter per minute cardiac output will be going out of the heart. Then vasoconstriction to hypoxia, the opposite to systemic circulation. So once the lower of blood vessels, once the oxygen is lower, the blood vessels constrict and redirect the blood to the better ventilated areas. Then high compliance can accommodate extra blood without a pressure rise. Then recruitment and detentions, the capillaries opens when demand increases. So this is a unique feature. The regulations, the passive regulations, so increased cardiac output will vessels passively dilate and the gravity affects the distribution also. Then active regulation, hypoxic pulmonary vasoconstriction. Once the local response, that is to the lower of oxygen level. Once the lower of oxygen level, hypoxic pulmonary vasoconstriction will happen. Then autonomic nervous system have minimal direct effect. Then um, chemical factors also we can monitor. Then coming into the clinical correlations. What are the clinical correlations? So as we have seen that pressure is one of the component in the pulmonary circulation also. The pulmonary circulation mean pressure should be around 25 mmHg at rest. Then causes maybe, so it once the pulmonary pressure greater than 25 mmHg at rest, we say that this is a pulmonary hypertension. So maybe it is due to the causes, maybe left heart failure, COPD, pulmonary embolism. So all these may be the factors. Then pulmonary embolism, there is a blockage in the pulmonary artery. And what is pulmonary edema? That is fluid in the accumulation in the lungs. Then coming to the end of the what, that is summary. So we have seen the what route it travels, so blood flow, and we seen that main function is to remove carbon dioxide and intake of oxygen. Then this is a low pressure system and a low resistance system. Unique feature is hypoxia causes vasoconstriction. So then clinical, we already seen the pulmonary hypertension, embolism and edema. Then pulmonary circulation, we see, okay, so the bridge between the right and left heart, making the life sustaining gas exchange possible. So this is the overall summary we have seen. So we come to the end of the topic. So thank you.